Okay, so we're gonna do some education from Frank Netter, Atlas of the Human Anatomy. It's my favorite book. And here we are. So we're gonna talk a little bit about your first rib and some of the deviations that you can have. So if you look at this diagram here, this is kind of showing your brachial plexus. This is just to orient your cervical or your neck vertebrae, and these are the nerves that come out from each one of those. So if you look here, you can see the first rib, how it kind of sits next to that. And if you look above, you can see some of the musculature. These are the scalene muscles. Maybe you've heard of having tight scalenes. You can kind of see how they connect down onto the first rib. Anterior scalene and middle scalene here are shown. Okay, so let's just start by stretching scalenes. That's one way that you can kind of tell if they're tight, is if you get a little bit of a stretch here. Anything?
Oh, I feel it.
Okay, and you should feel it like kind of through here.
Mm-hmm.
That scalene muscle runs, you usually feel anterior scalene. It comes down through here and attaches on the first rib. Right through here. Deep breath in. Exhale. Okay. So for Elise, her first rib moves pretty well. We're not too worried about it being elevated or locked, but sometimes you'll get hypo mobility or limited mobility of that rib. And if that's the case, it can create tension through the scalene muscles and tension on your brachial plexus and cause symptoms down the shoulder into the arm or fingers and hand. So I'm going to show you how to do a first rib mobilization while you're at home next. So to mobilize the first rib, I use a strap that is basically made out of seatbelt material. I can get this at the fabric store for about $3 or $4 and just sew a clip on. Or if you don't feel that creative, you can actually just Google online like Mulligan mobilization belt. And so you're going to take the strap, place it on the ground, step on it, and I'm going to show you how to mobilize this essentially as if it was your right rib. You're going to kind of palpate, so feel for your collarbone, and then feel just a little bit above that, and you'll feel the top rib. You want to place the edge of the strap right there, and then hold on to it, and then you're going to go into a little bit of a scalene stretch just to help it protrude and stick out a little bit. And all you're doing is creating a downward force with the hand that is holding the strap. You go up to the resistance of the rib and meet that resistance and then just oscillate slightly there. So it shouldn't be a big jerky motion, it should really be subtle. And you're gonna just oscillate maybe 20 to 30 seconds, keeping in mind that if you get any symptoms in your hand, to back off and come out of the stretch. So the idea is that we're creating a little bit of mobility through that first rib. It loosens that up and it takes the pressure off the scalenes and then subsequently alleviates the pressure on the nerves coming into your hands. So a lot of this is good if you're having thoracic outlet type symptoms, which are generally symptoms that would test positive if you go into an Adson test position, cold or tingling in your hands. And obviously a physical therapist would be a great person to come check out and see if that's something that you are experiencing.